President Don Williams, and Kevin Galvin, Chairman of a group of small business leaders supporting healthcare reform efforts. And we also have legislative leaders instrumental in bringing us to this day. Each of us will say a few words about healthcare reform, and then after that we will all walk together to bring these two bills up for the governor's signature. This afternoon, our message to Gov Rell is very simple. It is time for health care reform in Connecticut, and we have two bills that the legislative leadership and citizens across Connecticut have worked very hard on. For the last 2 years, Chris Donovan and I have traveled around Connecticut meeting with small business owners, and we have learned from these hardworking people who go to work every day, pay their taxes, play by the rules, that they are finding it very, very difficult to afford comprehensive health care coverage. From Berlin to Stamford to Norwalk to New London to New Britain, we heard the message loud and clear. People in the state of Connecticut need access to affordable health care coverage now. Healthcare costs are out of control, and it's hurting small businesses. They are facing very difficult decisions as to whether to lay off employees or drop critical healthcare coverage. We heard their message loud and clear, and we have answers in two bills, the Sustanet bill and the healthcare pooling bill, which will expand the purchasing power of the state health insurance pool and allow municipalities and small businesses and nonprofits the opportunity to buy in. Lowering health care costs is good for the economy, and it's good for taxpayers. It's a comprehensive and thoughtful approach that has worked in 25 other states across the country, and we are very, very proud to be able to walk the Sustanet and the pooling bills to the governor's desk for her signature. We think these two bills are the most important bills of the legislative session, and we hope that the governor will sign them into law. As the chief business registrar, I can tell you how critical these bills are to the health of our economy. Last year, more than 13,500 businesses closed their doors. Another 4,000 shut their doors in the first quarter of this year. So if we are serious about getting our economy moving and addressing one of the biggest challenges that small businesses face, we will make these bills law.
This is an exciting day in so many ways. First of all is the fact that we have these bills that we've worked on, and we can now deliver to the governor for her signature. That's exciting in itself. But also as exciting is the work of so many people who've worked for these bills for the last 2 or so years, that have fought for health care for the people in our state, for the businesses in our state, for the economy in our state, for the budget of our state. I want to thank the people who worked so hard in government. Secretary Lysowich was true. We traveled throughout the state. Senator Williams, my colleague, and the senators worked hard. Representatives Fontana and Ritter, the chairs of the Insurance and Public Health Committee, the House chairs, Senators Crisco and Harris, the Senate chairs of Insurance and Healthcare, all the various groups, the Sustanet group, the small businesses, the citizens who got involved in this process, because they know that healthcare is so important, and there has to be a way that we can have affordable healthcare for everybody at a lower cost than what we're paying now. And that's what these two bills do. They basically say we can have good healthcare. We can have good healthcare for people in the state, and we can save money doing it. This is the same kind of talk we're doing here today that's happening in Washington. I just came from Washington, and what are people talking about? The very same things. how are we going to do a plan that is good health care for people? The public wants good health care, but they also want it to cost less. And that's what these bills do. We are at the forefront of health care reform. And one of the other things that people are talking about in Washington is that there needs to be a public health care option available for people. That's what these bills do. These bills say that we can prepare the state of Connecticut, we can be Obama ready, and we can make sure that whatever happens in Washington, we will hit the ground running, and we will have the best opportunity to provide the best care for people in the state. I'd like to, again, thank everybody. I'd like to end with one of the talks Susan and I were about a year ago. We were in some town, I forget where we were, but we were talking about the bills and the option available to small business, small businesses. And there was someone in the insurance business who was trying to talk this individual out of choosing this plan as an option. And the small business guy says, look, I don't know if he said buddy, but that would help the story out. Look, buddy, we'll say that. I'll take the license. Look, I'm a small business guy. I make decisions about my business every day. What to purchase, what to buy. I'd like to see this plan the representative has, and I will determine whether or not that works for my company. From what I see right now, it looks like it works. But I want to have that option. Let's give small businesses, let's give cities and communities that choice to provide good health care at a low cost.
It's very important that we move these bills forward and that we ask the governor to sign them. Everyone knows that we need reform in our health care system here in Connecticut and across the country. In the state of Connecticut, we have about 3.5 million people. About 3.5 million folks live here in the state of Connecticut. We spend each year about $25 billion on health care. That's about what we spent to put man on the moon. But we do it every year. We spend that amount on health care in the state of Connecticut. What the sustenance plan will do when Governor Rell signs this bill is to spend that money in a wiser and better way. We know that we can ensure everyone in the state of Connecticut, that we can have access to quality health care for everyone, and do it in a way that wrings out the inefficiencies, brings better quality, moves us into the 21st century in terms of health care administration and delivery of services. And you know what? Probably do it less than $25 billion a year for a small state. We can do it. And with Governor Rell's help, the sustenance bill will be signed, and we will get that done in the next 2 years. And you know, my good friend Chris Donovan, he's worked hard on the partnership bill. We started talking about this a couple of years ago. Some folks call it pooling. What it really means is going back to the original concept of insurance, not cherry-picking healthy people and taking them out of the pool, but having everybody in a big pool so you share and spread the risk. That's what insurance is supposed to be about. But what the partnership bill would do is take a really big pool, with all the folks associated with the state of Connecticut in that pool, and open it up and say, if you run a small business and you have a tough time paying for health insurance, and we know that's true because right now they're predicting a 9% increase in premiums for our small and medium-sized businesses in the next year. So if you're having a tough time, come on in. Come on into the pool where we spread and share the risk, and we bring down administrative costs, and we can deliver healthcare insurance for less. That's what this is about. And you know, I think the applause is carrying up to the second floor, maybe. So if Governor Rell hears us, and she understands that signing the sustenance bill bill and signing the partnership bill is the right thing to do, then we can move forward in the state of Connecticut when it comes to reforming health care.
We've heard from some special interest groups like the Connecticut Business and Industry Association, who says their special interest is small business. And so we hope that they will listen to their clients, the clients of the Secretary of the State's office, and the drivers of our economy here in Connecticut. We have a very special person who has been, over the past 2 years, leading the effort of small businesses across Connecticut to get their message to our political leaders that healthcare reform is critical to the revitalization of our economy.
I'm Linda St. Peter. I've been a commercial realtor for 21 years. As president of the Connecticut Association, I'm here today on behalf of more than 18,000 realtors across Connecticut, all of them independent contractors, not employees. Obtaining affordable, accessible health coverage is a constant challenge for them and their families. We urge the governor to take action and sign this health care legislation. In a moment, I'll ask Governor Rell to take action now and sign these health care bills, and here's why. Governor Rell, you and I are a lot alike. We're both respected leaders faced with tough decisions in 2009. Affordable, portable, accessible, quality health care is the #1 issue among my 18,000 members again this year. We are both dedicated to bringing and keeping businesses in Connecticut. We're both dedicated to bringing and keeping the people who live and study and work here in Connecticut. We are both healthy and vibrant thanks to vigilance and healthy habits. We are both breast cancer survivors. But because I work for myself, as my 18,000 members do, our pre-existing condition precludes me from easily obtaining choices in portable, affordable, comprehensive health care. For those here who don't grasp the frighteningly far reach of what's classified as a pre-existing condition, it doesn't have to be cancer. It can be one allergic reaction. It can be one asthma attack. It can be one episode of high blood pressure on a particularly stressful day. It can be snoring. You might have a pre-existing condition and not even know it. Sustenance and the pooling bill does not disqualify one on the basis of pre-existing condition. And it allows small businesses and independent contractors the choice to buy into the program, or, if they have one, to remain in their current plan. Governor Rell, it's in your hands. The small business community, and through my voice, 18,000 independent contractor realtors, some uninsured, some underinsured, and some who access their health care through their spouses. But those folks consider themselves at any given point in time simply one paycheck away from joining the ranks of the underinsured and the uninsured. Governor Rell, your enactment of the sustenance and health care partnership bills will be a huge step in enabling Connecticut citizens to access affordable and adequate health insurance. Your signing this legislation will position Connecticut as a model for the rest of the nation, setting the stage to fix our broken healthcare system. We trust you'll have the wisdom to do so. Take action. Sign the healthcare legislation before you. We are putting our trust in your hands.
With that, we'll ask all of the people joining us today to follow us up to the second floor.
This is perfect. I got it.
Okay, very good. So we go right in? Okay. We're very happy to give you these two bills. First, we have the healthcare partnership bill that's on
realtors that is a great opportunity for the state of Connecticut. Opportunities knocking on the door.
And our small business communities and strong support.
Appreciate your efforts.
Thank you.
Any further comments, Governor Fuller?